Hi everybody, welcome to my World Stroke Day video. Thank you if you are a recent subscriber and to subscribers that have been with me for almost a year now. Couple of quick messages because it's World Stroke Day. Know your numbers, so be aware of your blood pressure, especially if it's creeping on the high side. Please do manage it, get checked out, get treatment, do what you can to try and reduce that. Cholesterol, make sure your cholesterol is in a healthy range as well. Drink a lot of water, cut the caffeine out. The other thing that I want to talk about, and I have kind of spoken about this in other videos, is the additional symptoms that are not really commonly spoken about, which would be balance, eyesight and migraines. So for me, my symptoms were balance and dizziness, kind of like vertigo, a bit of nausea as well, and a heavy leg. So those aren't typical symptoms, and again, there's, I think, a common perception that stroke only affects the elderly over 70, over 80s, and that's not the case at all. Anybody can have a stroke, any age, risk factors or not. So be aware of your numbers and be aware of those additional symptoms. The other thing I wanted to say, hopefully in this short video, is that in the kind of year that I've been doing these videos and putting up shorts of my achievements, my goals that I've set myself, my aim isn't to hopefully make anybody feel less than or worse, because I know how difficult it is to be working on so-called normal everyday things and finding that you can't do it, and it can be really disheartening, and having a stroke can be really isolating. So I would also urge people to do what you can do, try and focus on things for yourself and not to compare yourself to other people. There is no projected trajectory for stroke recovery. I think a lot of it comes from us inside and our self-belief, and that's certainly driven me quite far as well, I think. So always believe in yourself and be kind to yourself, be kind to the efforts that you're putting in, because that goes a long way. You know, speak to yourself as you would encourage other people, is always a good tactic to take. The things that I'm trying to do are me trying to get back to being able to do things I could do before. I'm a long way off from that, but I'm always going to keep trying. Over the year, the kind of 15, 16 months now that I've been recovering from my stroke, a lot of the things that I think are kind of hidden still is the mental health side of it, and mental health can apply in a lot of circumstances for a lot of health conditions, or even just on its own. So I hope my videos translate across that spectrum as well, that, you know, I always try to reframe my thoughts from anything that I find I'm not able to do anymore. I make that a starting point. I try not to dwell on the fact that I can't do it anymore, and I will look at how can I, or what can I do to try and improve the movement that I used to, that I don't have, that I maybe want to get back. So my videos are, I suppose, particular to me, about getting my feet moving, being able to put a ponytail in, using both hands because I'm a hand talker, being able to open and close my hand, which is quite weak still. I know it might not look like that in video, but it is quite weak. So on World Stroke Day, I just wanted to raise awareness again of those additional symptoms. Make sure you're mindful of your numbers, reduce your stress. And for anybody who is a stroke survivor and is watching along and looking at what I'm doing, I hope it's helpful. I hope that anything I'm doing is helpful, because we're all different, but what we all share in common is that struggle to find ourselves in whatever way that is again. And I just want to make sure that people don't feel isolated, and that there's a level of connection somewhere in your life, however you do that. So I'll sign off now, but again, thank you everyone for watching, for subscribing, and please share this video if you think other people might find it interesting. Thanks very much. Bye bye.